Bismillahirrahmanirrahim. Today is 13 December, Saturday, 2025, and now we are going to do this early pregnancy loss. This is for the theory purpose we are going to do, and we are after inshallah finishing, if we have a time, we are going to do the single best answer also. So the first one is that early pregnancy assessment na or the miscarriage. See, in this early pregnancy losses, what is the meaning of this early pregnancy losses? What it will consist of mainly? For the examination point of view, we have to understand that it will consist of the threatened miscarriage, miscarriage, incomplete miscarriage, or complete miscarriage. And you see this ectopic and molar pregnancy, it is not included in that one. Even the threatened miscarriage is not included there, because threatened will be the viable pregnancy na, so it will not consist in it, that one. So here it is consist of that one which we have it incomplete miscarriage, sorry, miscarriage, incomplete, and complete. These are the three most important which we are going to do it. Okay, now we
Okay.
have to understand. Okay, any patient means how we will assess the patient, because they will give the scenario in the exam, isn't it? So if the scenario is telling that a woman, she is having a positive pregnancy test, and she is presenting with a heavy bleeding, and she is shocked. And see, nowadays according to the new criteria or new guidelines everywhere, now they are telling, I don't know about the here Pakistan what we are going to do it, which they are following, we are following RCUG, isn't it? So now they make it, what is the meaning of heavy bleeding? Heavy bleeding means she will soak four pads, okay, more than 1 hour. Within 1 hour, at least she has to soak four pads, okay, full pads of the blood. Or after that, within 1 hour, okay, or every 15 minutes, she has a one pad. So 15 minutes means 1 hour. Every 15 minutes means 15 minute one pad, and the second pad will be 30 minute, 35, the next 45, and the 60. So it will be every 15 minutes, or the four pads soaked in the 1 hour. This is called the heavy menstrual bleeding, okay, heavy bleeding in the pregnancy. Okay, please, we have to remember that one, because this is I'm talking about the new guideline. Okay, so and
Okay.
then she can also having means new criteria they are talking about. I don't know, they will give in the MCQ or they will follow the old one. So and then they say afterwards she can have a, it mostly they will present with bleeding, but if she start to have a pain, okay, then it will be the conception will be changed, means the criteria will be changed. So we have two things, every patient whenever they are coming to the primary care center. Primary means she can go to the GP, she can go the any hospital. But when it is going to the hospital, if she is having a bleeding and the pain, then they have to refer that patient. So the referral criteria we have to learn by heart for the MCQ point of view. Here for us the important thing is that she will present with bleeding. Okay, but if she has a bleeding and along with that pain, then she has to be referred. This is the point we have to understand that thing clear. And if now we have to check for the patient, means we are doing the assessment of the patient. These are the MCQs about the assessment of the patient. So another thing, that if the patient, she will present with hemodynamically stable or maybe not stable, but if she is stable, okay, then we will do the medical management as an outpatient. Okay, medical management, mostly we will follow the medical management, conservative management as a outpatient. Okay, so when we are giving her the outpatient, but we have to give her the some advice, because she is going home now. At home she start to have a bleeding, excessive bleeding, pain, abdominal pain, and unilateral pain, especially unilateral pain, and then shoulder tip pain. So it means earlier that time she start to have we are missing that one, that miscarriage. So maybe now she is becoming now the atopic. All the symptoms now telling, these are called the red flag symptoms. So the question will be there, the MCQ scenario will be there. If the patient present red flag symptoms like excessive bleeding, severe lower abdominal pain, and new onset of unilateral pain and shoulder tip pain, all of the above or none of the above. So it will come as all of the above, because we are talking all of the pain. These are the particular pictures for the means red flag sign. Okay, red flag sign. This one we have, and they have to need the referral. Another things we have to remember in our mind, these patient red flag symptoms, they need the referral. Okay, ji. Then what we have, if she's 6 week pregnant, nearly 6 weeks, because at 4 week, nearly 4 week, 4.4 means 5 week, we have to have a gestational sac, appearance of the gestational sacs. So after 6+ weeks, she start to have a fetal heartbeat. Na, it has to be there. So what is happening if she is less than 6 week and she has some bleeding, but there is no pain? So, and there is no pain means she has no factors of the atopic pregnancy like previous atopic or shoulder tip pain or a lower unilateral pain. So we will advise her to repeat the ultrasound after 2 weeks. Ultrasound has to be after 2 weeks, because you see why we are talking about, because this is a very important MCQ. In MCQ they can give you that the patient is, she is less than 6 week and she is having a bleeding but no pain. So what you are going to do? He say ultrasound within 1 week, ultrasound 2 week, or urine pregnancy test. We have to do it after 2 weeks. So this is the first point. Whenever we are managing anything, managing means we have to do the assessment. First assessment, any patient come with this one less than 6 week, because maybe she has a delayed menses, na. So what we have to do, and we don't know that she has done the pregnancy test or not. Maybe this is her late period. So the first thing what we are going to do for her, we will do the pregnancy test. Okay, ji, urine pregnancy test we have to do for her after 2 weeks. Means 6 weeks she came, but she is stable, mild bleeding. So we will give her the time, because the pregnancy test can come, but the problem is that where we have to find the pregnancy. We have to also find the pregnancy, na. So after that one, this what we finish our business, this thing. Then after that one pregnancy test, we have to know about the, we will do the ultrasound. In the exam MCQ we have to go in a sequence, that we first will do the ultrasound and then we will do the pregnancy test. No, this is not the way. We are not means our resources, we are not throwing our resources. So that's why first, we any patient will come less than 6 week with PV bleeding and no pain. Remember, no pain. But if she has a PV bleeding, pain, then and less than 6 weeks, mostly it will go to the atopic. So that there is no pain. Only she came that she is having some bleeding, so maybe delayed menses, na. So we'll do the pregnancy test, and after pregnancy test, if we will do the ultrasound to know the viability of the fetus, na, or where is the fetus, outside or atopic or inside or whatever it is. Okay, then we will do the ultrasound diagnose. This ultrasound will make the diagnosis, and then after 2 weeks means it will be 8 week, na. So within 8 week the diagnosis has to be confirmed. So it will be a miscarriage, incomplete miscarriage, or complete miscarriage, or whatever a topic or whatever we have to have in our hand. Okay, so if there is an ultrasound, which ultrasound we are going to do? We will do TVS. TVS is the first ultrasound which will do TVS, and the per abdomen. So the MCQ can be like this: we will do the TVS or the per abdomen. Choice of ultrasound is the TVS. Okay. After, when we are doing the ultrasound, what we have to see? We have to see there is an intrauterine pregnancy or outside the pregnancy. Okay, so if we saw there is an intrauterine gestational sac or intrauterine pregnancy, we will not do the beta serum SCG. But if we don't find any intrauterine pregnancy, then we will do the beta serum SCG. I hope it is clear for you, because I am talking about the SBN
जी
also.
जी
Nadia, समझ आ रहा है?
जी
If
जी
you
बिल्कुल टोटली
understand.
समझ आ रहा है.
Okay, so we'll do like that one. After this, we will finish it. That one we will visualize the ultrasound. In ultrasound, we have to check for that one. Okay, ji. Then we have to check about, if we don't find it, this intrauterine pregnancy. Then what we are going to do? We have to locate where the pregnancy is gone. If it is not a visualized, then we will do the beta serum
बेटा
SCG.
ऐसे जी. हाँ.
If it is visualized, we will not do the beta serum SCG. Please, because this is very important and it will make, and 5 marks within 1 point you can get it with. So if it is not, then we will do the beta serum SCG. And one beta serum SCG is not, we can get it. We have to do 2. Okay, so we finish it. See, we finish at our side assessment. Now another question is that what is the diagnosis of the miscarriage? The how we will diagnose the miscarriage? Okay, we will diagnose the miscarriage by ultrasound. Confirm ultrasound. So ultrasound, how we are going to get it with the ultrasound? We have to have a pregnancy. This gestational sac, sorry. So get gestational sac, and if there is no fetal activity, there is no fetal heart, so and there is a fetal pole, we can say it CRL. Okay, if it is more than 7 millimeter on TVS and per abdomen, it is more than 8 millimeter. My dear, these are the new which I am telling you. So please
Okay.
remember that one. There is a difference, but there is a one important point you have to remember. This is CRL more than 7 or CRL more than 8. Okay, per abdomen and TVS. But please remember one thing, very important thing, that if you get the gestational sac, only gestational sac, but this gestational sac is the mean gestational sac diameter, they call it. Okay, so if you get that one more than 25 millimeter, it means miscarriage. If you don't get it, CRL means baby, you are cannot find the baby more than 7, more than 8, but you are getting the this gestational sac more than 25 millimeter, so it means it will be miscarriage. So this is the diagnosed miscarriage. Okay, one thing. And then we will do the transvaginal ultrasound. If we are doing, if it is less than 7 or less than 8, please remember that one. We are talking more than 7, more than 8, but if it is less than 7 and less than 8, okay, and then we cannot see the fetal heart, because sometimes we have to see the fetal heart, and if we see the fetal heart, okay, viable pregnancy. But if we don't see the fetal heart, then we have to see, but the it is less than CRL is there, means baby is there. Okay, so if baby is there, fetal heart is not there, then what we call it, uncertain viability. Okay, we will call it pregnancy of uncertain viability. Why we are talking about? We are talking about less than 25 millimeter gestational sac, less than 7 millimeter this CRL, and less than 8 millimeter by per abdomen. So this means this will be the pregnancy of unknown viability. Means we are not getting the fetal heart, but the pregnancy is there. Okay, entire uterine pregnancy is there. So what we will do? We will do the ultrasound 7 to 10 days. We will repeat the ultrasound, but here we are not going to repeat the ultrasound here. If her CRL more than
अच्छा सॉरी
7,
आपको डिस्टर्ब कर रही हूँ। कहने का मकसद है कि जब CRL हमें ग्रेटर देन 7 होगी और ट्रांस वजाइनल पे ग्रेटर देन 8 होगा, तो इट मीन के प्रेगनेंसी
no, no,
कंफर्म है,
no,
हमें
no.
रिपीट नहीं करना।
Transvaginal पे more than 7 और per abdomen पे more than 8.
अच्छा।
हाँ, ये है इसका क्राइटेरिया।
ओके।
और इन दोनों में गेस्टेशनल सेक का इन्होंने एक कर दिया, पहले डिफरेंस था। ये न्यू की बता रही मैं आपको, लेटेस्ट बता रही हूँ, 2025 की बात बता रही हूँ मैं आपको। उसमें क्या होगा कि वो जो है ना, वो मोर देन 25 मिलीमीटर गेस्टेशनल सेक जो मिलेगा ना हमें, वो मोर देन 25 मिलीमीटर, चाहे वो TVS हो पर एब्डोमेन हो,
ओके।
तो वो हमारा मिस कैरेज हो गया। मगर अगर हमें लेस देन 7 मिला, लेस देन 8 मिला और लेस देन 25 मिला, तो और फीटल हार्ट तो अभी मिला नहीं हमें, फिर नहीं मिला, तो हम इसको बोलेंगे प्रेगनेंसी ऑफ अनसर्टेन वाइबिलिटी। बिकॉज ये
ओके।
गेस्टेशनल सैक है, फीटस तो है, उसका फीटल हार्ट हमें नहीं मिल रहा, तो अनसर्टेन है अभी वाइबिलिटी। तो हम क्या करेंगे, उसको करने के लिए हम दोबारा अल्ट्रासाउंड करेंगे। तो अल्ट्रासाउंड देखिए डॉक्टर साहब, ये बहुत इंपॉर्टेंट पॉइंट है कि कितने दिन बाद अल्ट्रासाउंड करेंगे। या तो 1 वीक बाद कर लेंगे, या 7 to 10 days भी अगर लिखा होगा तो वो भी चलेगा।
ओके।
एक्चुअली 1 वीक चलेगा, 7 days चलेगा, मगर अगर 7 to 10 days इज देयर, इट विल बी ओके। Okay,
ओके।
okay, we finish this one. Now what, how we are going to diagnose about the incomplete miscarriage? So for the incomplete miscarriage, we have to do the ultrasound. These are all by ultrasound diagnosis. So we have to do the ultrasound, this retained product of conception. The endometrial thickness is more than 15 millimeter. Okay, ji. If it is more than 50 milliliter, it will be incomplete miscarriage. But if it is less than 15 millimeter endometrial thickness, so we will say this is complete miscarriage. But the problem here, we have to understand complete miscarriage we can say, or we can say it can be a atopic. Okay, so what we have to do, we have to ask for the previous ultrasound. Check. We have to confirm previous ultrasound that it is an intrauterine pregnancy. Okay, and now we are not less than 15 millimeter endometrial thickness. So it means this will be complete miscarriage. But if you don't have a ultrasound, previous ultrasound, and we are not getting anything, endometrial thickness is also less than 15 millimeter. So what we are going to do? We are going to do for her the means ultrasound, we have to repeat it, or beta serum SCG. Best is the beta serum SCG. We will repeat beta serum SCG until the beta serum SCG is going down. If it is a pregnancy is finished. But if she will start to have a atopic, it will be in between, which we call sub-acute. Sub means sub-acute, na? It will be not going doubling is not there. If it is a doubling, then what we are going to do? If it is a doubling, it will be intrauterine pregnancy. Okay? So we finish it, that one. Now we have another thing in our hand. Sorry. My God, 1 second. Na? Okay, Ji. So what we have it here, so we get that one. Now how we are going to manage it? Because we have only 3. So management is 3 types: conservative, medical, and the surgical treatment. Conservative management we are going to do if she is stable, hemodynamically stable patient. She want the conservative management, one thing, and she is not having excessive bleeding or an infection, or she is stable, then we can do the conservative management or the medical management. Otherwise we cannot do for that one. Okay ji. So treatment, how we are, this is very important. 2 medication we are going to use in medical treatment. Conservative management we will observe her for 2 weeks to see her the bleeding, and we will tell her if you start to have a heavy bleeding, you have to come back, and we will not give her more than 2 weeks. Before they are saying the 4 week and more than 6 weeks, but now they say no, 2 week is the best time we can give her, not more than that. So this we finish conservative. What we will do in the medical treatment, we will use 2 medication, mifepristone 784. This is, we call it mifepristone. We will use it, and after mifepristone we are going to use it misoprostol. This is cytotec. After 24 to 48 hours, after 2 days. But this mifepristone, it is very expensive, na. So this one, it is every hospital. They have to put when the patient is inside. You are the one who is going to put it, and then let her to go for home for 24 to 48 hours, and she can come back. Then you will admit her and you will put the misoprostol. Misoprostol means cytotec. You will put for her. Okay, ji. And this misoprostol or cytotec we can give her buccally. Better to give her buccally rather than oral. Oral, why we are not giving? Maybe she will start to have diarrhea, mostly diarrhea or nausea and vomiting orally. So that's why from the buccal we are going to go as a medical management. Okay, if and then we have to check it, means first we give her the misoprostol, and then we have to, after this one cytotec, mifepristone, misoprostol, we both given, and she don't start to have a bleeding. So what we are going to do? We are going to wait for her and advise to tell her to second dose we will give her. Okay, we will give her the second dose after 48 hours if she don't start to bleed. The same 48 hours after mifepristone, we will give her 48 hours to put the misoprostol. Okay, the cytotec. And the same here, second dose we will start after 48 hours. These hours are very important. They are very particular about this MCQ question. So even after that one, how much dose we will give her? Total we will give her 4 doses. Okay, the mifepristol, how much? 400 milligram. Microgram, microgram. They see mifepristone is microgram. Okay, and sorry, I'm telling you the wrong one. I'm also getting the confused one. Okay, ji, it is here. Here, misoprostol is microgram. So what we will give her? This we will give her misoprostol 800 microgram. Okay, 800 microgram, and that will misoprostol, this mifeprostol, sorry, mifeprostol is 200 milligram. This is the one correct now I'm telling, because I'm very weak in numbers. Doctor mostly are weak in number. I don't know, maybe you are good. Okay, then this is our medical treatment, finish it there. Then we will start about the surgical management. Surgical management we have two. Manual vacuum aspiration and electrical vacuum aspiration. This one, manual vacuum aspiration we can do in the clinic, but the patient has to be less than 9 week. Okay, and but if it is more than 9 week, she has to be admitted in the hospital, and we will do the elective vacuum aspiration. This is the one we have to do. This is the important. This is the difference. Okay, and this we finish it, then we have to do the follow-up ultrasound if she is having a it is going for conservative management. Now he is talking about the conservative management. After 2 weeks we will give her 2 week time, and after 2 weeks we will do the ultrasound for her that the pregnancy is gone or not gone. Okay, so after 2 weeks we finish this one. The medical treatment, even medical treatment what we are going to do, both in that one we will do the pregnancy test after 3 weeks. Here the difference is that ultrasound we will do after 2 weeks, and the pregnancy test we'll do after 3 weeks. So please, this is very important. Now, if the pregnancy test is positive, it means there is an ongoing pregnancy. Okay, so we have to locate where the pregnancy gone. And after that he say she need the follow-up we already talk about the ultrasound we will do, or we will do the pregnancy test, one of that one. Okay, and then we have to call her the patient, for because all the product we send it, we have to send them for the histopathology, must be send it. Any product we get it, we send it for histopathology. This is the histopathological examination. And then the another question, very important question, is that the complication of miscarriages. What are the complications? It will be unsuccessful management of miscarriage may be there, and she can have a chronic endometritis. Okay, she can have this. Most important is this one, but the rare complication means still there is a retained product, and we have to do the curettage. Retained products is still there. So these three are the most important one. Now the most important question, what are the causes of the miscarriage? Okay, the most important thing, we have to do that the follow-up. Okay, what is the most important cause of the miscarriage? It is the chromosomal abnormalities. It is 70%. 60 to 70% chromosomal abnormalities are responsible for that one. No? And there can be infection, there can be high blood pressure, diabetes, and all this blah blah. So we finish this one. I hope it is clear or not.
जी क्लियर हो गया। अच्छा, ये कंफर्म करना था कि मतलब जो हम लोग पहले मिज़ोप्रोस्टोल से पहले मिफेप्रोस्टोन देंगे उसको 48 आवर्स तक।
जी, पहले देखें एक होता है मैफीप्रोस्टॉन 200 मिलीग्राम है, वो मिलीग्राम में है। और जो साइटोटैक हम जिसको बोलते हैं या मीज़ोप्रोस्टॉल बोलते हैं ना, वो माइक्रोग्राम में, और वो 800 माइक्रोग्राम हम देंगे फर्स्ट डोज में। अगर 48 आवर्स में ब्लीडिंग नहीं हुई, क्योंकि वो दोनों डोज ले चुकी है ना, नहीं ब्लीडिंग हुई, तो 48 आवर के बाद हम दोबारा डोज रिपीट करेंगे। तो 4 डोज, सॉरी,
मीजो का 48 आवर्स के बाद रिपीट करेंगे।
हाँ, वो भी, उसमें भी 40 मैफीप्रोस्टॉल जो है ना, मीज़ोप्रोस्टॉल हम 48 आवर्स में देंगे उसको, ठीक है। और वो तो घर ले चली जाएगी ना, लेके जो चली जाएगी। फिर दूसरी हम कहेंगे वो उसके, और उसके बावजूद फिर हम देखेंगे कि भाई अभी तक इसका बेबी अबाउट क्यों नहीं हुआ, मतलब मिसकैरेज में अभी ब्लीडिंग भी नहीं हुई है। तो फिर हम क्या करेंगे, उसको 48 आवर देंगे। उस 48 आवर के बाद दोबारा हम डोज लगाएंगे, दो
3 to 4 डोज देंगे फिर।
हाँ, टोटल जो होती है ना 3 to 4 डोजेस है, इससे ज़्यादा हम नहीं दे सकते। देन शी हैज़ टू गो फॉर द एवाकुएशन, सर्जिकल। ठीक है, ओके ओके जी, सब आई विल